Welcome back to Atlanta and Company. I'm Christine Pilar. It's great to be with you today. She is my go-to doctor when I want to look 10 years younger. I'm talking about Dr. Jean Chapman from LaserMed Skin and Vein Clinic. From Botox to fillers, I'm getting some tomorrow, to fillers to laser resurfacing and vein problems. It's true. I don't care about admitting it. Dr. Chapman specializes in procedures meant to make you look and feel more beautiful and better than ever. She joins us now to talk today about smart lipo and varicose vein treatments. Welcome, doctor.
Hi, it's such a treat to see you 2 days in a row.
I know. I'll see her tomorrow, too. I love it. And today we want to focus on two things, so we got a lot to get to. Let's start off with smart lipo. How is it different from liposuction?
Smart lipo uses laser heat to melt the fat, so to speak. So instead of using the usual cannula and the manpower to get the fat, you're actually melting it more evenly.
Ooh.
And the laser heat also coagulates. So if there's any bleeding, it'll stop the bleeding.
Wonderful.
And what comes out is so much easier and less traumatic to the patient. So. And another great thing about using the laser is that while it's in there, it actually heats up the tissue, which gives about 40% more tightening, skin tightening.
Wonderful.
Yeah.
So let's talk about the typical recovery time. Are we talking just a few days?
A few days of swelling and some drainage will also happen. However, for about 2 weeks, I'd say you still have a little bit of soreness here and there.
Okay, that's not bad.
So I'd say 2 weeks is usual recovery time.
That's great. And who is a good candidate?
We really like to focus smart lipo for those that are already doing the healthy trim, already doing the
eating
exercise,
right, sure.
doing everything they can, and yet there are pouches here and there. They're either genetically born that way or they had babies or this or that, those problematic areas that you just cannot do something about, those are the perfect candidates for smart lipo.
And doctor, I know we're seeing some pictures right now. That is incredible, and that is a tough area. Even I'm starting to get that. Well, it's hereditary. I love my mom, and she's gorgeous, but that chin under the skin, or skin under the chin, and now we have that belly, I mean the belly area, which of course if you've had babies or if it's just genetic, either way, those problem zones that just don't budge, even when you're trying to do all the right things, that's where this procedure would come into play.
Yeah, exactly. I had a runner that runs 6 miles a day, and she was just genetically bigger in her saddleback area. She was this big around everywhere else, and she said, can you do something about it? We actually got a lot out from those areas for her, and her 2-month follow-up pictures were amazing. She looked like the rest of her body now.
Right, and I'm sure she's thrilled, because that's if you've had a problem area for a while, it's frustrating. You have to decide what you're going to wear, and you're always trying to cover it, strategically. So that's fabulous. Now, are we awake during the procedure?
Yeah, absolutely. A lot of patients actually bring their iPods to listen to their music, or we just talk about everything.
Right.
Yeah, and
it doesn't hurt.
We do give you some pain medication and local anesthesia called tumescent anesthesia. With that, absolutely everyone is very at ease, and it's a very comfortable procedure.
Relaxed. Okay, good. And now let's talk about varicose veins, because that is a problem. The varicose veins are a problem. Spider veins, varicose can lead to more health issues. Spider veins just plain old don't look good. But let's talk about the difference in, is it ablation? Is that how you say it?
Yeah.
Okay.
The varicose veins, typically we have done stripping, which causes a lot of downtime, a lot of complications, and a lot of missed days from work.
Right.
Now, the laser is being used for so many different things, where you could actually find the reflux where the vein or the valves are not working properly, and you can actually ablate that vein through a tiny little needle access. So you're not even being cut during this procedure. And same thing, we give you pain medication and local anesthesia. You walk in and you walk out, and even later that day you can go back to walking or working.
Wow. And who's a good candidate for that one?
Anyone that has varicose vein or leg tiredness, pain or swelling, any of those associated with noticeable varicose veins would be a good candidate.
Okay, good. And I imagine that might be covered by insurance.
Almost every time it is covered by insurance. Once I do the diagnostic ultrasound test, and and I'm able to show that there is leakage in their vein,
Got it.
then I can certainly submit it to insurance. So we've not had any problem with getting it covered.
Sure, because that could lead, again, to other issues. But something like, you know, getting my spider veins treated, that would not probably be covered by insurance, right?
No.
No. Unfortunately, no. That's okay. That's all right. They still need to be done. And let's talk about, are you awake? You mentioned it's pretty, same thing, we get the local anesthesia, so we're not going to feel anything, right?
Right. As I said, we use a needle access. So I do give a tiny little local anesthesia. At the site, I'm going to enter the needle, and the laser fiber actually goes through the needle.
Okay.
So you really barely feel anything, and even after the procedure, there's no incision or scars or anything to show for.
Wonderful. Wow.
Yes.
Thank you. I will see you tomorrow. I appreciate
Absolutely.
it. I always appreciate your time.
Great.
And if you would like some more information, log on to lasermedskinclinic.com. or give them a call, 678-990-4900, 678-990-4900. Carla will probably answer. Tell her I said hi.